talk about, we're still in the health field, but now we're going to talk to Keneta Wright, who is the founder of Nightingale's Home Health Agency. Thank you, I just lost it. Here it is, Nightingale's Home Health Agency. Thank you, Keneta. And Shauna Helton, and you've referred some resources to Shauna because your child, Elijah, who's 14 years old, has autism.
Yeah.
So we're kind of talking about a combination. It sounds like Nightingale does a lot. Now, I met you through a friend of mine, and you're helping with her home health care.
Yes.
But you also do some other things. So tell us about Nightingale.
Well, Nightingale's, as mentioned, is an agency, so mostly we think about the services that we charge for. But today, like in honor of autism awareness, I'm here just to talk about the things that they don't necessarily know we do. We have a lot of community resources that we offer. We're trying to devise support groups for our families with autism and for our families that can't afford our services or don't have the insurance coverages that they need. We offer free services. We teach chronic disease self-management classes, diabetes self-management classes, and healthy lifestyle workshops.
So how did you get into this field?
I got into this field because I'm a nurse by nature, but I noticed that there were a lot of readmissions in the hospital setting, and it was because once you came in for an acute illness, once they were discharged home, they didn't have anyone to care for them. So it was just like these people were sitting there. So I'm like, well, there has to be something that can be done about it.
Right.
So then I started Nightingale's Home Health Agency, and as a company, I'm noticing that there's still things that people need. We can provide the services for them, but they need to be able to have some self-empowerment or education about how they can take care of themselves also in our absence.
Wonderful. I know Shauna's glad you gave her some resources. Shauna, well, tell us about Elijah. He's 14 years old.
Yes, he's 14. He's on the autism spectrum, which he has a formal diagnosis of Asperger's syndrome as well as ADD.
Okay.
He was diagnosed actually probably about 7 years ago, but
So he was about 7 years old.
yeah,
Okay.
I was a single mom most of my life and found that it was very, very, very difficult finding resources, getting help, just having the emotional support, knowing what other parents may be going through, and as a single mom, it made it 10 times more difficult because by the time I would find help, I was in tears, hysterical, not knowing what to do, trying to work, and trying to manage, a child with special needs. As well as, manage with the schools and whatnot, and activities of daily living. So with this autism awareness, I'm hoping that we can get some more resources out there for people that's gone through what I've had to unfortunately go through.
Right, now you're saying Elijah was diagnosed when he was 7. Was he showing any symptoms or signs that maybe something was autism related before that?
When he was about 2 years old, he started having some social difficulties in preschool. Now he is high functioning, there is different levels, so unfortunately those kind of kids slip through the crack just a little bit because they do can socialize to a certain extent but doesn't quite get what the social norms are.
So they're in there in school, and a lot of kids I understand with Asperger's, and I don't, this isn't a medical thing, but just what I've heard, they really do well in school. They're sometimes the top students in the class, but they're not getting along with the other kids.
Correct.
Yeah.
Exactly. He's actually gifted. He's very, very smart. But the problem was with the awareness was with the other children. They are not aware of what Asperger's syndrome is. So he would play and interact, but it was a little bit different and backwards, compared to what the other children would play at their age level.
Right,
so it was quite
So
difficult.
I guess having a diagnosis must have been a kind of relief in a way, was it? Or
I was in denial at first because, at first he seemed like, he maybe just being along with peers and that kind of stuff. It was lack of not knowledge. I had to learn, and I needed resources, and I lacked the resources. And once you become more knowledgeable in the subject and you have more people that can intervene and help, you become stronger, you become a better advocate for your child, and you can help your child grow, and you can teach other people and other children what it's like to live the life of an autistic child.
that's really important, especially in terms of helping teachers understand and helping, and as you said, helping peers understand.
Correct.
Oh, that's wonderful. Now what kind of resources were you able to give, Shauna?
Well, pretty much what we do is just work with the parents of people that have disabilities. And so pretty much whatever it is that they're lacking, like if they need resources as far as like how to get in contact with Children's Hospital, what classes are available, training session. The Kelly O'Leary Center is a great source of like trainings, and they have classes each month that they offer.
It's the Kelly O'Leary
Kelly
Center.
O'Leary.
I've never heard of the
It's at
Kelly O'Leary.
Cincinnati Children's Hospital.
Okay.
And every month they send out a list of classes about autism awareness, what to do once you get the diagnosis, things like that. And so what we're doing is just trying to get a support group together for parents that are just like, I don't know what else to do. I might not necessarily want an agency because I'm trying to handle this on my own, but I just need additional help. Now, Shauna is very, she does pretty much everything on her own. She just works as hard as she can, and she just makes it work for her. But a lot of parents, they're just like, it's just overwhelming for me, so.
And, you know, the education is a key part of it, because you were saying you had to educate yourself. You had to get out there and figure out, you know, what is Asperger's, you know, what does autism mean, what to do, how to educate others.
It's about looking through the eyes of a child that has autism. It's quite difficult to do that.
Right.
I had a hard time finding sitters, you know, that would kind of help recognize that. It's looking through different eyes and really trying to have that empathy for what their world may seem and feel like.
Right. And how is Elijah doing?
He's doing fantastic.
Good.
He's got great self-esteem. He's just doing wonderful.
That's fantastic. Give us the Nightingale's phone number.
That number is 513-278-3270.
Okay, one more time.
513-278-3270.
And that's Nightingale's Home Health Agency. I actually got it right this time. Like Nightingale's Nursing, Nightingale's Home Health Agency. Thank you so much, Keneta. Thank you, Shauna.
Thank
You have to come back
you.
soon. Stick with us. We'll be back in a moment with Vanessa Sambola and some community events.